Am I clearly audible and visible to you guys? Let me know in the chat box. Let's start the class. Just a minute. I'm checking the preview. Yes. I can see all the good evening, good evening. Just let me know is the audio video is perfect. Then we start the session. I'm waiting for your thumbs up in the chat box. I think camera is now okay. Perfect. Now perfect, right? Okay. Let me know in the chat box audio and video. If everything is fine, then we'll start the session. And now, okay, it's perfect, right? Everything perfect. Okay, okay, okay. Good evening, guys. So today is our topic, which is very important topic for your FMGE exam. And many of the students requested me that this topic is they feel like it is some difficulties there in this topic, right? I don't know, but it is a very easy topic, right? So I will try to make this a topic very easy for you guys, right? We'll try to make this a topic very easy for you, and it's not like something big, okay? Just there are some key points or the key words are there, okay, which we have to remember. If you remember those, that this topic will be getting very easy and smooth, right, for you, all of you. And if we talk about the importance of this topic, so please remember, always and always in the ophthalmology, in your FMG exam, there is a one question is coming from this topic, short. So what we'll try to make this in this 1 hour session, we'll try to summarize this all this stuff, and we'll make a short summary over there, and I will try to explain you well this particular neuro-ophthalmology topic. Okay, so let's start, not wasting the time. We'll start this session, right? And in this session, we have to start with the overview of this session particularly, right? So what is the overview saying? Please listen this part. For the neuro-ophthalmology overview, we have the three things in the neuro-ophthalmology. What are the three things? Please remember about it. The three things which we are having here, we having the first, which is the visual pathway. What guys we are having? We have the visual pathway. What do you mean by this visual pathway? Please understand this part. What do you mean by this visual pathway? In the visual pathway, from the taking from this all the receptor from the eye, right? All the receptor, which is the light which is recepting on the retina, this will be going to taken up by the brain, right? How this pathway will be going to follow on this is the important, the first and very important one, right? That how our the lights, okay, the lights which is the falling on our retina, this will be going to carried by the neurosenses, and it will be carried till to the visual cortex, which is situated where? Which is situated in your occipital cortex, which is situated into your occipital cortex, which is the first thing. Now, for understanding it, we have to talk about it, how this will be going to convert. We'll talk about in this session. The second thing, which is in the neuro-ophthalmology, we have to study, that is your pupillary reflex pathways. We have to learn about the pupillary reflex pathway. How our pupil is reflexing, as if we're talking about the pupillary reflex. So there are the two reflex are there. The first is the light reflex. Write down here, guys. Okay, first is the light reflex, the second is the near reflex. Okay, so we have the near reflex, and we have the light reflex over there, right? So we have the two reflexes are there. First, near reflex, second, light reflex. Okay, so these are the two reflexes which are there. Okay, now, is the video is not working, guys? Sorry for this disturbance, guys. Just a minute. Sorry for this disturbance. Just a minute, guys. Yeah, it is fine now, right? Sorry for this disturbance, guys. Yeah, perfect. Okay, so we was talking about the your near reflex and the light reflex. So these are the pupillary reflexes which you have to know about in the neuro-ophthalmology. And there is a pathway, guys. Please remember there is a pathway which is going to make this particular reflexes. So for making this reflexes, we have a particular pathway over there. So we have to learn about those pathways also. Okay. The next, which is the third one, which is a very, very important, guys. In the third one, which we have to talk about the extraocular muscles innervations. And what kind of innervations, guys? Please remember, we have the three particular cranial nerves which are involved in this. Okay, what are those? Those are your the first one, which is the cranial nerve number 3, cranial nerve number 4, and cranial nerve number 6. So this all are the which is your participating in this. And I hope for this in the extraocular muscle you have to remember one mnemonic, which is your SO4 LR6, and the rest is by the third cranial nerve. What is the SO is your superior oblique, which is supplied by the fourth cranial nerve. LR is your lateral rectus, which is supplied by the sixth cranial nerve. The rest is by the third cranial nerve. What are the rest we left over there? Please write down there. That is superior rectus, inferior rectus, medial rectus, and inferior oblique. So these are the four which is going to supplied by the which will be going to supplied by the your third cranial nerve, by the your third cranial nerve. Okay, now moving forward for this, that what will be going to read about this, because this the extraocular muscle is also innervated by this nerve. So this is also coming into the neuro-ophthalmology. So in the neuro-ophthalmology, the three things we have to study about it. The first, which is the visual pathway, how the retina is sensing the lights, and this is moving forward going to the our visual cortex. This is the thing. The second thing, what are the our reflexes of the pupillary? This is also connected with the, your brain, right? This is controlled by the brain. So this is also connected with the your new in the this is also coming into the your neuro-ophthalmology. And the third thing, which is your extraocular muscle innervations, because this is also by the your three cranial nerves, third cranial nerve number 3, 4, and 6. So we have to talk about these also, right? So these are the three important topics. Now, for out of these three topics, for the today, we are going to talk about the visual pathway. Okay, we are starting with the today's topic, which is your visual pathway. And what is a visual pathway, which is already written over there, guys? That the retina is the first sensory, which is sensing, right? Which is sensing the your light, and then this all the senses which is converted. This is the converting. The retina is the receptor, guys. Please remember the retina is the receptor. This is a receptor for the light receptor. Guys, remember this is for the light receptor. So this the retina is the receptor, and it is recepting the light. And after the recepting this light, guys, not only this, after the recepting this light, it is converting this light, right? It is converting this light into the neural signals, right? And send this particular signal through the particular signal through the your optic nerve. Send the signals to the your optic nerve. Okay, now this optic nerve is continuing, right? The optic nerve which is exiting the eye and going behind and reach to a crossing, which is known as chiasma. So I'm just write down here crossing, okay, which is known as chiasma, right? We'll talk about this chiasma, and after the crossing of this chiasma, that will be going to continue at the tract, which is known as the optic tract. And after the optic tract, there is a processing body is there, and this is known as your lateral geniculate. nucleus, or we can say the lateral geniculate body. After this lateral geniculate body, there will be the analyzing this all the information and sent to the optic radiations. And this optic radiations continue this to till to the our visual cortex, right? So this is continuing our all the information till to the visual cortex, till to the visual cortex. So this is the all the pathway, right? Through this pathway, our all the information is going on. So what we have to study today, if I'm talking about the today's session, so we have to study about this all of this particular visual pathway defects and the visual pathway problems. Okay, for understanding this, we have to talk about a little bit anatomy of the our visual pathway. So let's start with the firstly with the your visual pathway anatomy, right? So this is the important thing, that is a visual pathway. We have to study about the visual pathway anatomy. Now, through the anatomy, as we talked about it, there is a receptor, which is your retina. Okay, there is a receptor, which is your retina. After this receptor, as we talked about this is our optic nerve, then optic chiasma, then optic tract, lateral geniculate body, or we can say the lateral geniculate nucleus also, guys, right? We can say the lateral geniculate body, or we can say the lateral geniculate nucleus also. And after this lateral geniculate body will be continued as the optic radiations, and this optic radiation give this all information to the visual cortex. So if I'm talking about it, this with optic nerve will be go to the optic chiasma, and please make it like this. Optic chiasma will making the crossover, right? After the crossing, it will reach to the optic tract. Optic tract will continue till to the lateral geniculate body. Lateral geniculate body continue to the optic radiation, and optic radiation will carry to the optic cortex. So just remember about it, about this cross. Just remember about this crossing. Okay, just remember about this crossing. Okay, this is the main crossing which is over there, right, with the optic tract. Now moving forward, that how this will be going to looking into the your anatomically. So you guys can see over there a clear picture of the visual pathway is seen on your screen, right? All the elements which we talked about it just now in the theoretical form, now I will going to explain you and show you at every level how it is going on, right? So just check it out. The first of all, this is the eye. Okay, so this is the eye. Okay, so you can see this is the eye, and just from the eye there is a exiting. What will be going to exiting? There is a exiting the optic now. So this is our first element which we are talking about it. I'm just giving the numbers over there so you guys can notify that all the things, right? Just a minute, with the red color, so I think it will be clearly visible to you. This is the number one, which is the optic. Now, just after the optic, now we have the optic chiasma. Just behind the optic nerve, we have the optic chiasma, and this optic chiasma and this optic chiasma will be continuing as the this after the optic chiasma, this will be continuing as this one is the optic tract. Okay, this will be continuing as the optic tract. Okay, now this one, third one, is the optic tract is here, guys. Just I'm mentioning here, so guys you can see over here, this after this is the third one, which is the optic tract. Okay, now the third one is the optic tract. After the getting out from the optic tract, this is reached to the your fourth one, which is the lateral geniculate nucleus. This is the fourth number, lateral geniculate nucleus. And after the geniculate nucleus, this is known as fifth number, which is your optic radiations. After the optic radiations, it reached here, and this is the your sixth and very important thing, which is your visual cortex, right? So what is this? This is the over your visual cortex. So these are the all the steps which we have to learn today in this session. And what kind of the questions they are asking, guys? Listen this part very carefully. They are going to ask you that at which level there will be the problem by giving you the investigations, or maybe they can give you like they given you already the visual problems and they're asking you the location of the lesion, or maybe they can give you what they can give you the lesion right at the site of the lesion, and they can ask you what will be the visual disturbance will be going to see. So this kind of the tricky questions they are asking, the clinical questions out of this topic, right, out of from this topics. So now talking about in the brief, just for understanding this, I'm going to take a one more image over there, right? I'm going to take here one more image over there, and I'm going to zoom in little bit. Okay, just wait for it. Just wait for it. Just a minute, guys. Just a minute. I'm trying to tell you about this important thing. Is it clearly visible? Yeah, visible, right? Okay. Little bit of blurred image is there, right? Sorry for this disturbance, right? As I'm zooming in, so there is a pixel will be breaking, right? Okay, no issues, no issues, right? Little bit clearly visible. Now listen this part, guys. There is the two things will be there, right? Which you have to remember about it, which is very, very important. That there is a two important things are there, which you have to understand is the known as a basic of the neuro-ophthalmology. If you understand this basics, please remember this. If you understand this basic, there will be the very easy this making is very easy to this your topics. Now starting with the first one, you can see over there is a visual fields, right? So we have this particularly your left side of the eye, and this is your right side of the eye. Just listen this part clearly. We have the left side of the eye, we have the right side of the eye. Also in this we have the two type of the visual fields. Like if I'm talking about in the vision, so our one eye is having also the left side of the visual field and the right eye of the visual field. Like I'm clearly saying to you, if I'm talking about the my eye, this is the my left eye, right? So I have my this left side visual field is by the left eye here, right? If I'm closing this eye, this is the left side of visual field, and this is the my right side of the visual field, right? The same thing in the right eye also, I have the left side of visual field and the right side of the visual field. But there is a tricky question is there, that this is a contralateral thing which is making by it. Now if I'm talking about at the level of eye, or I can say the level of retina, what will be going to seen over there? This retina is divided into the two parts. This retina is divided into the two parts. What are those two parts, guys? Listen this part. The lateral one, which is known as your temporal fiber, and the medial one, this is known as your nasal fibers, right? And this will be your temporal fiber. So you guys can see over there, if I'm talking about it, if I'm taking you about to the again to the back to this image, I hope now you guys can see over here there's a two different colors of the pan are used in this particularly. You can see this blue one, you can see over there, this is your temporal retina. Can you see? And also on this side also, this red one is known as your temporal retina. Is it right? But can you see over there, which is in the nasal side, right? This is the nose, right? Which is the nasal side, and these are your nasal retinas, or we can say the nasal half of retinas. Okay, so we have the nasal half of the retinas, we have the temporal half of the retinas, right? So the retina is also divided into the two part, nasal retina and the temporal retina. Now listen this part, that how they are making the crossing over there, right? How they are making the crossing over there. You guys can see over here, you guys can see over here that this left side of the visual field from the left eye is making on the temporal view, is making on the nasal pathway in the crossing of it, and the nasal view will be making on the temporal fibers of the retina. Can you understand this thing? If you are not understanding, just by checking out it, you can see over here, this is the visual field, And by the notifying the visual field, you guys can see over there that this part, which is, you can say, the temporal visual field, or we can say the left side of the visual field, right? This left side of visual field will be going to make the perception on the your nasal fibers, and this nasal side of view, or we can say the right side of view of is, this will be going to make over on the temporal fiber of retina. Are you agree with this? Did you understand, guys, till here? Did you understand, guys, still here, that they are making the crossing over, right? They are making the cross views always and always. Okay, so if I'm talking about it now, listen this part. If I'm talking about it, I'm closing my this right eye. If I'm talking about just my about the left eye, my left eye, this is the nasal view, right? So my this left eye nasal view will be going to make over on the temporal fiber of the my retina, and my this temporal half of the view will be made on the nasal half of the retina. Did you understand this thing? This is the contralateral, if I'm talking about it, with the visual view and the retinal fibers. So if I'm taking in a single note, if I'm note down this in a single note, so I can say that, what I can say that, I can say that my temporal half of view, now listen this part, my temporal half of the visual field is making perception on the nasal half of the retinal fibers. My nasal half of the visual field is making on the my temporal retinal fibers. Are you agree, guys, with this? Are you agree with, guys, this note particularly, that yes sir, this is making the our understanding that these half are the contralaterally making this particular, making this crossover and making it easy, right? Now after the making it, now listen this part, let's zoom out it, right? Now yes, now after the making this, what will be going to happen, this views will be going to continue. As this views will be going to continue, this neural perception will be going to continue. This is continuing as the first thing, which is known as optic nerve, right? So I can say over there, this is the optic nerve. Just check it out. This is the particular optic nerve, right? So just I'm erasing all the other things which we have to return over there, this numbering and all. So I can make some easy things for you. So you will be guys going to reply me some things, right? Okay, now I make a round over there, right, on the optic now. Guys, can you tell me, as this is the right side of the eye and this is the left side of the eye, can you tell me which fibers are continuing in this? Now listen this part, which fibers are, listen the question, which fibers are continuing in the right side of optic nerve, which I make as a circle over there. Can you identify this circle? What is over there? Just I'm telling you, guys, just you have to write down here, just note down here, this is having the right side nasal fibers, and it is also having the right side temporal fibers. You guys can see over there that these fibers are coming from the right side of the eye. And which fibers are coming, guys, over there? Which fibers are coming? The both fibers. You can see over there, right side nasal fibers are also coming, right side temporal fibers are also coming into the right side optic nerve, right? And the same thing, if I'm talking about here, I'm making a circle over here also and ask you about this. So you guys can tell me, this is the left side of the optic nerve. Of course, it is having the left side nasal fiber and the left side temporal fibers. Okay, so both kind of the fibers are there available, as there will be the continuing of the both the fibers and exiting this eye from the by the optic nerve. Okay, so they are getting out from the optic nerve. Now there is a big thing which you have to understand over there. Now at the level of optic chiasma, what is happening, just check it out, this section. I'm zooming in this section and just to check it out, just check out this section. Okay, just guys, you have to see only and only this particular section. Okay, just I'm drawing it, which section you have to see, just this one. We have to talk about this box. Okay, what about this particular box? Just check it out, that I'm seeing over there, this is the temporal fiber from the right side is coming, and it is without the crossing, it is continuing directly. Can you see, this is continuing directly to the this side only. The same thing I'm seeing on the left side also. The left side temporal fiber is continuing the same side without the making crossing over it. But guys, but there is a thing which is the important. What I saw there, I saw here there is a nasal fibers. You can see over there is a nasal fibers are there which are making the crossing over. And you can see over there, this right side nasal fiber cross and went to the left side. Okay, and the left side nasal fiber are crossed and went to the right side. Is it clearly visible to you guys? Can you identify this thing? Can you identify this thing after zooming in? Can you identify this thing? That there is a temporal fiber I shown you. They are continuing directly. They are continuing directly. But there is a nasal fibers which are making over there the crossings, right? What they are doing? They are making the crossing over it. And what is the point where they are making the cross? They are making the cross at the optic chiasma. Okay, what the point are there where they are making the crossing? They are making the crossing at the optic chiasma. And if I'm showing you in another diagram, if I'm showing you in this diagram, this will be also giving you the same thing. So you can see over there, this is the temporal fiber. What kind of temporal? This is the left temporal fiber, and you can see this is the left nasal fiber. Okay, and this is the right nasal, and this is the right temporal. Okay, so these are clearly seen to you that temporal fibers are continuing on the same side without the crossing, but you can see over there these nasal fibers are making the cross at the level of optic chiasma. Is it clear to you guys? Is it clear to you? Now listen this part. After the crossing of it, after the making the cross over it, now that they will be not going to make any crosses and they will be going to continue. So if I'm going to talk about you on this level, let's come back to the our old image. If I'm not talking about this optic chiasma, the next which is our optic tract. If I'm talking about the optic tract level, what I have on the optic tract level, on the left side of the optic tract, I have the left side temporal fiber as it is continuing without the crossing over, and the right side nasal fiber. Am I right? Because right side nasal fiber are crossing over at the optic chiasma and coming to the left side, and left side nasal fiber are crossing over and go to the right side. Okay, so this will be here. And if I'm talking about on the right side optic tract, what we'll be going to see, just making a thing, that here I have right side temporal fiber, which is without the continuing, without the crossing, it is continuing. So this will be here, and I have what, left side nasal fibers. So this is the crossing over there. And now please remember, after this crossing, there is a no other crossing. So at the lateral geniculate body also, this will be the same. At the optic radiation also, this will be the same. And at the visual cortex, these fibers will be going to the same. The same on the left side also, optic tract, left side optic tract, left side optic radiations, left side optic lateral geniculate body, and your visual cortex. This all the three, please remember this, all the three will be having the same fibers over there. So now if I'm talking about the making the conclusion of it, so just one conclusion which you have to remember of this. What kind of conclusion we have to remember on this? Please remember the one thing, that the first thing, which is our visual field is making the crossing. Okay, like if I'm talking about this is on my left side temporal view, right? This is my left eye, and this is the temporal view of my left eye. So this will be going to making perception on my nasal fiber. And now this nasal fiber will be going to crossing over at the optic chiasma. So the two type of the contralateral crossing is there. The nasal fibers are crossing at the optic chiasma, and our visual pathway is making like crosses. Okay, like nasal view on the temporal fiber of the retina, temporal view on the nasal half of the retinal fibers. Now, did you understand this anatomy of the visual pathway? Did you understand? Right? Now we are talking about, this is the general anatomy, right? This was the general anatomy, right? And now if I'm talking about it, the defects of this visual pathway. Just let me know in the chat box, guys, who guys are watching live or maybe watching in a recorded format. No issues. Whatever the, in whatever format you are guys watching here, just let me know. Just let me know. Is it understandable for you? Is it understandable for you? Let me know in the chat box. I'm waiting for your answers in the chat box. I'm waiting for your answers in the chat box. Yes, guys, I'm waiting for your answers in the chat box. Let me know, because this is a very important thing. If you understand this, then there will be the no issues. Yes, very good, doctor. Very good. Now, good. We are moving forward. If you understand this thing, we are moving forward for the next. Now, next, what we are having? We are having the defects of this particular pathway. What kind of the defects we are having, guys? Please listen this part. There are the different levels. Okay, what we guys are having over here, there are the different levels, as I told about you. And in the different levels, at this, in different levels, we are having the different visual disturbances. Okay, in the different levels, we are having the different visual disturbances. And out of this visual disturbances, and out of this visual disturbances, we have to talk about the important one. Okay, so what kind of the defects are there? Let's talk about it. Let's talk about it. Let talk about it. The first one, that there is a visual pathway defect which is occurs due to the lesion along the route from the retina till to the occipital cortex. So in the every defects, so we have to see the at the every level. Okay, what are the those levels I told you, like from the starting from the retina, optic nerve, optic chiasma, optic tract, lateral geniculate body, optic radiation, and the last, which is the visual cortex. So one by one, all of this we have to talk about it, and what they are going to cause in it. Please remember about it. They are resulting into the characterizing visual field abnormalities. So they are giving us the what? They are giving us the abnormalities of the visual field abnormalities. Now, not only the visual field abnormalities, they are also the they are making the some more symptoms also, which we are going to talking about just after this slide. There are the some symptoms, and with this symptoms, we are getting what? The visual field abnormalities also. Now, for the understanding the anatomy is the key for the localizing and the diagnosis. So, as why for understanding the anatomy, which is the key of it, guys. Please remember, as I mentioned over there, this is the making star. If you understand the anatomy of this particular thing, okay. If you understand the anatomy of the visual pathway, you will going to understand this, right? As I already clearly written to you. So, as I explained you the anatomy, if you understand the anatomy, let's move forward for the now for the defects. Okay, if you understand the anatomy, let's talk about the defects. Okay, so now starting with the defects, if I'm talking about the defects, starting with the defects, the first and the one, which is the symptoms, which we have to talk about the common presenting symptom. So we have to talk about what? We have to talk about the common presenting symptoms, right? What kind of the symptoms will be possible here? Now, the first one, maybe we can see over there the vision loss. Maybe the patient is not having any vision, the vision is totally lost. Okay, the first thing. In this, the second thing, we can see over there, maybe the patient is having some double vision, which is causing the diplopia. All right, maybe some patient, this the all the neurological disorders I'm talking about it. Okay, all the neurological. Okay, we are talking about the symptoms of the neuro-ophthalmology. Okay, third thing, maybe there can be see the eyelid drooping, which is the ptosis, you know very well, which is known as the ptosis. And you know very well, there's the three type of the mild, moderate, and severe type of the ptosis is there, which is by the different muscles, right? LPS and your molars is participating in that. There's the abnormal pupil reactions, right? There will be seen the abnormal pupillary reactions. Also, there is a visual field defects, which we have to talk about it. We are talking moving on it, right? And there is a headache with the some visual symptoms are also the common things. Now, starting with the next, which is the anatomy of the visual pathway, which we have to key feature, as I told you. We talk about it, all the steps, like all the 7 steps from the starting from the retina and ending at the visual cortex. But what are the functions of that? Please listen this part. This is a very important thing. What are the functions of that? This is a very important thing. For understanding these functions, I mentioned this all the function in a list form. Okay, what I did, I mentioned this all the symptoms or all the your I mentioned all the important systems working on this in a list format. So let's talk about the first one, which is your retina. So you already know about it, guys. The retina is doing what? It is converting light into the neural signal. So this is the receptor which is converting the light, right? Light rays which is falling on my eye. They are going to convert into the neural signals. Optic nerve is there, which is making the transmission of the signal to the brain. It is carrying out from the all the signal from the eye and continuing to the towards the brain. And the next we have the guys optic chiasma, which is nasal fiber crossing here, make a star over here. It is a very important thing which you have to always remember, that nasal fiber are crossing at the your optic chiasma level. Optic chiasma level. The next we have the optic tract, which is going to what? It will be going to lead to the lateral geniculate nucleus. Okay, lateral geniculate body, or you can say the lateral geniculate nucleus after the crossing. Next, the lateral geniculate nucleus, this is the your thalamic relay station. So what is it is doing? Whatever the neural signals or the neural signals are coming to it, it will be doing what? It is making a relay station, right? This is making the relay of this all the signals and sending the forward. The next, which is the optic radiation, this is the travel to the visual cortex, and this now after this lateral geniculate body, this all the signals will be going to traveling or the continue to the visual cortex. And the last, the visual cortex is doing what? It is processing this visual input. Whatever the signals are coming from the towards from the brain, from the eye till to the brain, this is now going to do the processing of this visual inputs. Now this is the processing at the our visual cortex. So you guys can see over there, if I'm going to show you again the our last to last image which we had to study, you can see over there it's starting from this rays which are coming from the your visual pathway, visual field, and reach to this visual cortex. This is the making from this to this is all by this all the steps. So this is the important anatomy which you have to remember over there. If you understand this all the functions and you studied this anatomical location of this all the 7 things, so now we are moving forward for the defect part. Okay, now we are starting with the defect part, and starting with the defect part with the first one, that if I'm talking about the retina, in the retina all the lesions of the retina we are talking in the separately into the retina chapter, right? That your CRVO, CRAO, papilledema is there, optic neuritis is there, this all the stuffs are over there. We are talking about the retina into the retinal part. Starting with this, just behind the retina, it is exiting the all the neural signals into the optic nerve. So the first thing is over here, which is the your lesion at the optic nerve. Okay, guys, what is the lesion? Lesion at the optic nerve. Now, guys, listen this part carefully. What will be the causes will be going to cause this optic nerve lesion? The first one, which is your optic neuritis, maybe ischemia of this optic nerve, ischemia of optic nerve. Okay, ischemia of optic nerve, maybe the compression of this optic nerve due to the any other tumor, or maybe any other neighbor organ, neighbor part which is compressing on our optic nerve. So this can be the possible, right? It is a very easy thing which is very easily possible over there, that optic nerve is getting compressed by the maybe near some tumor is growing on over there, or maybe with the any other neighbor lesion. Okay, now moving forward for it, what will be the visual field defect will be going to seen, and please highlight this will be going to see in your monoocular vision loss. What will be going to seen over there? This will be the seen as the monoocular vision loss. And what do you mean, guys, by this a monoocular vision loss? Just for understanding this, I have created this image. You have to understand this thing. You guys can see over there that that is a damage at this level, which is known as optic nerve. Yes, this is the optic nerve, right? So this is the at the optic nerve. And what is the mean of monocular, guys? You can see over there what are the fibers over there. There is a fiber of the temporal view and the nasal view of the right side. Yes, so it means temporal bhi gaya, nasal bhi gaya. So this vision will be not there, and this vision will be also not there. It means the right sided is the totally vision loss. So you can see over there. You can see over there. If I'm talking about it, this is the left side, this is the right side. Okay, so you guys can see over there that there is the totally right side visual loss. So the right side is having the total vision loss. Can you understand this thing? The first image which I'm going to show you here, that this is the particular fixed image they are asking you. If the right sided, if right sided optic nerve is damaged, what will be going to see? So this will be your monoocular vision. Only one eye is visible. Can you see the left side vision is only there, right sided vision loss is there. So this is known as the monoocular vision. What it is known as? This is known as monoocular vision, or we are saying this is the right sided total vision loss. Okay, now moving forward, for the next thing, that in the optic nerve, what are the signs can be seen? Guys, please remember about it. In the RAPD, this is your pupillary defect, right? We'll talk about it, the pupillary defect later on the part. But remember about it, at this is the damage, the monocular vision loss is there. So decrease the acuity. Of course, it is decreased till to the blindness, or we can say the perception of the light. Yes, just till to the perception of the light. Also, there is a color vision deficiency will be, or the defects will be going to seen over there. And guys, please remember, if I'm talking about the example of this your optic nerve lesion, so please remember it is seen in the optic neuritis in the multiple sclerosis. I hope you know about it. The multiple sclerosis is a dangerous disease, right? There will be yes, your neurons are getting the decreasing, yet, or your neurons are getting damaged over there by this making out this demyelination of this your neurons. Okay, so this is the in the optic nerve. If they're getting the demyelination, so this will be getting the our optic nerve will be getting damage over there, right? And this is the type of the optic neuritis which will be going to seen into the your particularly will be going to seen into the particularly will be going to seen over in the your particularly seen will be going to in the your multiple sclerosis thing. Okay, now moving forward, and you guys can understand. Okay, so I will make the summary of it, right? I will going to make the summary of it. Just wait for it, right? I will give you the summary of it. Understand? Now moving forward for the next one, that lesion at the optic chiasma. Yes. So the damage at the which level? The damage is now at the optic chiasma level. Where is the your crossing of this your nasal fibers, right? And please remember about it. What are the causes of the optic chiasmal lesion? There is a pituitary adenoma or craniopharyngioma. Why this all is there? Please remember the optic chiasma is just above at the sella turcica. And what is the sella turcica, guys? You know very well. This is the anatomical location where is your pituitary gland. Yes, about the pituitary gland. This pituitary gland is situated over there. So if your pituitary adenoma is there, guys, if the patient is coming with your pituitary adenoma, so now what will be happen, guys? Listen this part. I'm going to show you the image. So you guys will be going to understand over there that this is the sella turcica. Okay, and there is a pituitary situated. Now, if from the below side, if the pituitary is getting adenoma, so it will be going to tumor will be going to enlarge over there the pituitary, and this will be going to compress over the chiasmal lesion. And guys, please remember about it, where it will be going to make the lesion. Now you guys can see over there. I'm not talking about it. This is just making lesion at the central part of the optic chiasma. Yes, and as you can see over there, just the central part is gone, right? So if I'm talking about the lesion of this optic chiasma, what kind of field your fibers are there? There is the right nasal and the left nasal. These two are there. Yes. And now you can see over there, just I'm going to do what? I'm going back with it, with the fibers. I'm going to see which vision will be going to loss. Okay. So just I'm going with this nasal fiber going back. So this vision will be going to loss. Okay. Right sided temporal vision. And now going back to with this left sided, this left side also, the temporal vision is gone. So you guys can see over in this second number image that there is the temporal side of vision. This is the temporal, this is the nasal. Okay, this is the nasal, this is the temporal side of visual field. I am talking about it, guys. I am not talking about the fibers. Fibers will be going to cut it by the nasal fibers only. But you know very well this nasal fiber are crossing and making the visual field of temporal side. Okay, as I shown in the starting image only, and I have drawn here also. I'm making the contralaterally. So this two vision will be going to loss. Okay, right side temporal also and left side temporal also. You can see over there, right side temporal is gone, left side also the temporal is gone, and this is the particularly known as the bitemporal hemianopia. And guys, please make a star over there because this is your PYQ. Okay, this is the your previous year questions which is several times asked in your FMGE exam, that if the lesion at the optic chiasma, what kind of the visual losses will be going to seen in this such kind of the patients, right? So this the patient will be going to seen, you know very well, this particular patient will be going to seen very well that this patient is having the bitemporal hemianopia. And guys, please remember what are the causes of it. The causes of this particular, we talked about it, that pituitary adenoma is the cause and pituitary craniopharyngioma. Okay, now we talked about the visual field loss. You know very well visual field loss is the bitemporal hemianopia. And if I'm talking about the mechanism of it, what kind of the mechanism? There is a compression of the crossing the nasal fiber. We talked about it that this will be going to compress the your nasal fibers only. So that's why the nasal view will be going to gone. Now it may affect also the pituitary functions if the tumor related. Of course, that this optic chiasmal lesion will be going to affect, will be going to seen with the pituitary functions will be also will be going to seen with the this affecting thing. Okay. Now, so you guys can see over there, we studied with the two things. The first thing, if I'm making a little bit summary over here, right? The short summary I'm talking about it. In the short summary, if the optic nerve is damaged, the same side, yes, same side, SS I'm writing, the same side, total vision loss. Yes, the same side, totally vision loss will be seen over there, right? The next, if I'm talking about the optic chiasmal lesion, at the optic chiasmal lesion, which is the central optic chiasma, there will be the bitemporal hemianopia. Yes, bitemporal hemianopia. So this kind of summary I will going to give in this the session, in the last of this session. So you have to just go through this summary. If you remember this all the mechanism and you remember that particular summary, you will be going to clearly make out the answer of this particular topic. Now moving forward, this optic chiasma is done. Now moving forward with the third one. Just the third one, before starting the optic tract, I'm going with the one more. That is the important one, which is the third one. You can see over there, in the third one, there is a cutting of what? If I'm making of this, the lesion at the which level? Just the lesion at the left side temporal fiber. The lesion at where, guys? Left side temporal fiber. Just we'll follow the same fiber and we're going to see over there. So I'm going to follow this fiber and I'm going to see over here that there is a vision loss will be going to see. There will be the vision loss will be going to see, and this vision loss will be which kind of? This is just and just the nasal view of left side is gone. Yes, the nasal half of the view of the left side is gone because at the optic chiasma level, the centrally the nasal fiber are crossing. But the peripherally, if I'm talking about the side of it, they are containing the temporal fibers. So there is a cutting at the side of the temporal fiber. So this side of the temporal fiber is, if lesion on at this, so there is a left side nasal hemianopia will be going to see, right? The half of the nasal view will be The half of the nasal view will be gone at the left side, and this will be the your third one, right? This will be the your third one. Now, moving forward with the optic tract, this is the fourth one, and I'm continuing with the optic radiation also in the same into the number 4. Okay, so there are the number 4 with the optic tract and the your optic radiation. Both will be going to same in this. Why, guys? Because the fibers are going to continue in the same. If I'm talking about this fibers, just take it out. What is this I am having here? I am on the left side temporal fiber, right side nasal fiber. The same I am having over there, right? I talked about it after the crossing. After the crossing, there will be the same fibers will be going to continue over there. The same fibers will be going to continue over there, right? So there will be no more changes will be seen there, right? So just we talk about this two in together, and later part we'll talk about the last, which is the our visual cortex, which is the fifth number. This is the visual cortex. Yes. So let's talk about the your first one, which is your lesion at the optic tract. Now, if I'm talking about this optic tract, just remember about it. The optic tract is what? After the crossing of, after the making the crossing of your optic chiasma, after the making the crossing of your optic chiasma, what we'll have? We will continue as the optic tract. Now this optic tract is having what? If the lesion at the optic tract is there, we're going to see over there the contralateral homonymous hemianopia. And what is this? Please listen this part. I'm going to tell you. Please listen this part. The first of all, right? That if there is an example I'm giving you, right side of optic tract lesion is there. So the left side field will be visual field with the loss. Contralateral means opposite. And if the example I'm given you here, you can see over there, what is the lesion? Lesion at the left side of the left side of the eye, or the we can say the left side of the optic tract. So the right side of the half vision will be lost. You can see over there, this is the right, this is the right. Yes, so this is the right side of half vision will be gone, and this is known as right homonymous hemianopia. If the same I'm talking about it, if the right side of the optic tract and right side of optic radiation is gone, the contralaterally homonymous hemianopia will be going to seen. So what will be going to seen? They will be going to see the left homonymous hemianopia. What will be going to seen over there? They will be going to see the left homonymous hemianopia. So you can see over there, right optic tract lesion, left side vision loss. It means the both left half will be going. So that is known as left. We're going to write left homonymous hemianopia. Yes, and if the left optic tract lesion is there, we're going to say the same, the contralaterally. It means your right homonymous hemianopia, which I'm going to show you here in this image number 4. You can see the right side, both of right vision is gone, right? So this is your right homonymous hemianopia. The same thing will be going to seen into the same thing will be going to seen into the your optic radiations. But if I'm going to little bit depth of the optic radiations, now listen this part. If the both of this optic radiation, just I'm going to tell you, if the both of this fibers are in the optic radiation is cut it down. Now you can see over there are the two fibers. Just I'm taking you into the deep. You can see over there, these are the two different fibers are going on, right? If the both of this is cutted, the same scenario will be going to seen as you are seeing over there. Yes, the same scenario will be going to seen as you are seeing over there. But if there is a, this is the above one, so this is known as the parietal fibers, and this is the lower one, this is known as the temporal fibers. So just I'm writing here, this is the temporal fibers of optic radiation, and this is the your parietal fiber of optic radiation. Because as it is the above one, so this is going like from here, so this is known as the parietal. It is near to the parietally, right? And whatever going to the downwards, this is known as the this is known as your temporal one. So the parietal and the temporal we are dividing in like that. Okay, so if the only the parietal is damaged or only the temporal is damaged, now listen this part. If this the short half of this fibers of the optic radiation is damaged, they will be going to see the quadranopia. And what is the mean of quadranopia? Like in the hemianopia, the half of vision is gone. In the quadranopia, just a quadrant of the vision is going to gone, right? So we'll talk about it. Let's finish the optic tract one. And please remember about it. What other it can be going to show? It may show the relative afferent pupillary defect, which is your RAPD, which is in the contralateral eye will be going to seen, and this oftenly seen from the oftenly it will be going to cause by the your stroke, trauma, and the tumors at the optic tract. Please remember about the optic tract. This is the regions are there. Now, as I talked about you, the temporal fibers and the parietal lobe lesions, right, or the parietal lobe fibers, right, the two are there. And out of this, the temporal fibers are also known as the Meyers's loop. Now remember about it. The same thing will be going to happen over there, that contralateral superior quadranopia will be going to seen in the pie in the sky will be going to seen in the temporal lesion. As remember about it, the temporal is the below, parietal is above. But if this will be going to temporal will be going to damage, what will be going to see? Pie in the sky. So I'm going to show you the image of it. You guys can see over here. This is the lesion at the optic radiation at the Meyers's loop, or I can say that at the temporal pathway, right? And what will be going to see? There will be the superior quadranopia. It means the pie in the sky. So you can see, guys, this is the quadranopia. This is the quadrant, which is, this is the half of this, we can say the quadrant is there. This quadrant will be going to, this particular quadrant will be going to missing over there, right? And it is not looking like that. There is a total cake is there and this pie is missing. So that's why this the name is given, the pie in the sky. This was name as the pie in the sky. The same of this, guys, please remember, if there is a parietal lobe lesion is there, so the contralateral inferior quadranopia. Inferior quadranopia, it means the pie on the floor. So what will be going to seen over there? So you can see over there, this is the lesion at the inferior quadranopia, which is the lesion at the parietal pathway. So you can see over there, this will be going to same the contralateral. Guys, please remember, as I can show you now, you can see over there, this is the both side, right is gone. It means you can see over there, what is the lesion? The lesion at the left side Meyers's loop. Yes or no? Because this will be going to contralaterally. And if I'm talking about, this is the left side of the quadranopia, so I can say you, this is the lesion at the right side of parietal lobe. This is at the right side of the parietal lobe. So that's why this will be going to making the parietal pathway damage, right? And they are making the contralaterally what? They are making the contralaterally your pie on the floor. Is that clear, guys? So this is the about the optic radiation. If the optic radiation is fully cutted, again I'm showing you the image. Again I'm showing you the image. If your this is the fully gone, so this will be going to show, this fully gone is showing you the this. If the temporal fiber is gone, there will be the pie in sky. Yes, pie in sky. If the parietal is gone, this one, what will be going to see? Pie on floor. Is it clear, guys? So pie on the floor, pie in the sky. This thing is clear to you guys? Is this clear to you guys? So we completed whatever we completed, guys. I'm just summarizing you again within a 1 minute. If optic nerve is damaged, the same side total vision loss will be going to see. The first thing. Understood? Good. Moving forward. The next thing, if there is an optic chiasma lesion is there, at the optic chiasma central lesion, what will be going to see? There will be going to see the bitemporal hemianopia will be going to see to you. Right? Now, the third thing, if the side of the optic tract is only damaged, only the one side of the optic tract is only the damage by the side fibers, only the temporal fiber is gone from which is coming from the retina, there will be the same side nasal hemianopia will be going to see. The same side nasal hemianopia will be going to see over there. The next we move forward for the optic radiation and the optic tract. The fully optic radiation is going to cut. The fully optic tract will be going to cut. The contralateral side homonymous hemianopia will be going to see. So if I'm talking about it, the left side of the optic tract is damaged. So the right side homonymous hemianopia will be going to see. If the right sided optic tract is gone, there will be the left sided homonymous hemianopia will be going to seen over there. Right? Is it clear, guys? And now I'm moving forward. And I'm now moving forward for the last one. What is the last one, guys? Can you tell me what is the last left? The last one which is the left is your visual cortex. And now listen about this particularly thing. What will be going to seen over there? In the visual cortex also, there is a visual field will be lost as the contralateral homonymous amyotropia. And why there is a homonymous amyotropia the same? Because the fibers are continuing the same only as we talked about it. There is a no fiber changes are there. But guys, please remember there is a often with the macular sparing. And what is this macular sparing? This is due to the macular sparing. It is due to the blood supply of the your visual cortex. So what kind of this macular sparing will be going to seen over there? Just check it out. Just check it out with me. I'm going to show you what do you mean by this macular sparing. So now you guys can see in this particular image, which is the last one we have to talk about, this fifth one, right? This is the fifth one which we left over there. So you guys can see over there, is it clearly visible or it is, no, I'm not covering it, right? It is clearly visible to you. Now listen this part, this fifth one is showing you what? This fifth one is showing you the same, you can see over there as it is the right sided damage. You can see the right sided visual cortex is damaged. So the left side of the half, right? The left side of the contralateral hemianopia is the seen. So you can see of there is a left homonymous hemianopia is seen. But there is a macular sparing is guys there. What is this macular sparing? This particular space. Can you see? This particular space which is over there, this is known as the macular sparing. Okay, so this deficit, right? This particular deficit is known as macular sparing, right? So this particular deficit is known as macular sparing. And guys, please remember this will be going to see you often into the what? This will be always and often will be this often will be going to see you with what? This will be going to see with the your visual cortex. Now the important the causes of it, guys. The cause of this particular visual cortex, this is the occipital stroke. And you know very well the occipital is supplied by the, I hope if you know about the all the things with the circle of Willis, the which is supply blood supply of the brain. This is the posterior communicating artery will be going to supply the this posterior communicating artery will be going to supply this your the territory of the posterior communicating is supplying the your occipital cortex, and this will be causing the occipital stroke or maybe trauma of the occipital lobe, maybe the trauma of the occipital lobe. Please remember, if the bilateral occipital damage, it can cause the cortical blindness. What kind of the cortical blindness? The cortex is gone, just the middle of the vision will be left, like the both side is gone, the both side the occipital is damaged. So what it will be going to, it will be left this vision. Okay, the central vision will be going to left over there. This cortical vision will be going to loss into the bilaterally. Okay, okay, as the half of the macular sparing, if the both side is damaged, so this will be going to make what? Just they will be left with this two macular sparing. Okay, and the rest all will be the dark. We can say this to the tunnel vision also, or we can say the cortical blindness also. So make a star over there on the cortical blindness also. Okay, now moving forward for the next, please remember about this visual field image, this one. This is a very important, again I'm marking here the important which you have to remember. Okay, which you have to remember. I explained you all the things, you have to remember this, and you have to remember this too also, which is the quadranopia, right? Superior quadranopia, which is the pie in the sky, inferior quadranopia, which is the pie on the floor. So these are the two quadranopias which you have to remember also. Now moving forward for the next, which is the visual field testing. What kind of the testing we are doing nowadays? Please remember, we have to help the localizing the lesion along with the pathway. So we have to first of all the localizing the lesion. What is the lesion site? Through this visual pathway. Nowadays we are doing the automated perimetry, which is example of your Humphreys perimetry, which is used commonly. And I'm going to show you now the reports of this Humphreys perimetry to identify it and interpret it with this. And after this Humphreys perimetry, we are interpreting the results in the context of the neuroimaging and the symptoms also. We can do the neuroimaging. By the neuroimaging, we can do the MRI, right? We can do the MRI also in this patient. And also, this is essential for the diagnosis of the neuro-ophthalmological disorders which will be needed of it. Now, for the making of this particular summary of this lesion, before the making the summary of this lesions, I have to talk about with the some important Humphreys perimetries. So can you see guys this one particular Humphreys perimetry which is shown you on the screen? And now let me know what kind of vision loss is seen to you and what is the location of this particular vision loss? Can you tell me? Can you tell me, guys? What kind of vision loss is there? So you guys can see over there the vision loss. Can I notify you? Just remember this. This is the temporal. This is the nasal. This is the nasal. This is the temporal. So both side temporal half is gone. Guys, what is known as? This is known as your bitemporal hemianopia. And this bitemporal hemianopia is the location at the optic chiasma. So this is at the optic chiasma. Now, moving forward, guys, you can see over there, this is the temporal, or this is the nasal, and this is the nasal, and this is the temporal. Or you can see over there, this is the right, this is the left. So the both side right half is gone. It is known as your right side homonymous hemianopia. Yes, this is the right-sided homonymous hemianopia is there. And what is the lesion site? Please remember, this is the lesion at the left side optic tract or the full optic radiation. Guys, not the fiber of this Mayer's loop and the parietal or the temporal lesion. I'm not saying. I'm just telling about the full, right? So I'm write down here in the bracket full damage. Okay, so full fiber damage or the optic tract and the optical radiations. And the last one I'm showing you, you guys can see over there also, there is especially the first of all by this marking you can see there is a macular sparing. So what are seen, this is also the both side of the right side is gone. So this is the right sided homonymous hemianopia with macular sparing. If I'm talking about this, what is the lesion site? Please remember, the lesion site is your left side visual cortex. Yes. So what is the lesion site? The lesion site is your left-sided, yes, left-sided visual cortex. Homonymous hemianopia, right side. Very good, guys. Very good. Very good, doctor. You are replying very well. Yes, correct, correct. So this kind of the interpretation will be needed over there. So this is the Humphreys perimetry report, which will be going to help us to identify this your particular lesions, and by this also we have to do some neuroimaging also. Then the neuroimaging kind of like MRI and all, this will be giving the suggestive of it, right? This will be going to suggestive of the location of it. And guys, this is the lesions and the visual defects summary which I'm giving you, the today's session summary I'm giving you. And guys, please note down, it's a very important. If you remember this summary, this will be going to help out you in your FMG exam and securing your 1 mark. What are this? If the lesion at the optic nerve, there will be the monoocular vision loss on the same side. So just write down on the same side. Okay, on the same side, right? Right side optic nerve is gone. Right side monoocular vision loss. Left side optic nerve is gone. Left side monoocular vision will be going to loss. Optic chiasmal lesion, what will be the scene? There will be the bitemporal hemianopia as we talked about it. No issues will be there. What will be seen on the optic tract? On the optic tract, we'll be going to see the contralateral homonymous hemianopia. If the right-sided tract is gone, left side homonymous hemianopia. If left-sided tract is gone, right-sided homonymous hemianopia. So contralateral will be going to seen. On the temporal radiation, in the optic radiation, in the temporal, we're going to see the superior quadranopia, which I can write here pi in sky, pi in sky. And if I'm talking about the parietal radiation, in the parietal radiation, there will be the inferior quadranopia, which is your pi on floor. On the pi on the floor. What will be at the occipital cortex, or we can say the visual cortex? I already told you the same contralateral homonymous hemianopia, the same as what the optic tract and optic radiation will be going to cause in the fully damaged, plus minus macular sparing. So due to the blood supply, if the blood supply is damaged over there, there will be the fully damaged. If not, there will the macular sparing will be going to present over there, right? So make a star over there. And this is the important summary of the our today's session. And here we finish with the all the visual pathway defects, right? All the visual pathway defects are clear over here. Is it clear to you guys? Now, at the end, I'm going to show you if you have any queries related to this particular session and queries related to the ophthalmology subject, you guys can contact me on my Telegram. This is my Telegram username, Dr. Vaibhav Ahuja. You can contact me directly over there. Also, you guys can follow me for such more sessions, updates, and notifications are related to your exams, related to the classes. You guys can follow me on my Instagram, which is the dr.vaibhav Ahuja. Right? So you guys can follow me on the Instagram, and if you have any queries, you can ask me over there. Also, you can guys can contact me on my Telegram channel. This is a Telegram username also, right? If you have any doubts related to the such sessions, okay. And that's it for today, guys. And thank you so much for this particular session, right? And I hope you are covered with this particularly visual field topic, which is in the very important part of the your neuro-ophthalmology. Okay, guys. Thank you so much. Goodbye. Good luck.